Hello. So today I'm going to talk to you about vaccine reactions. So vaccines, kind of the way that they're supposed to work is they're supposed to stimulate the immune system to teach it how to fight off a disease. Sometimes the immune system kind of doesn't appreciate being stimulated, so you can get a reaction. This can happen with any vaccine out there. It is a little more common with certain ones. So in dogs, it's a little more common with rabies and lepto. With cats, it's a little more common with FELV, but it can happen with any vaccine. And your vaccine reactions can range from very mild to very severe. Your more mild vaccine reactions are just going to be a little bit of pain and swelling at the injection site. Sometimes you'll get a little bit of scar tissue that develops at that injection site, especially with the rabies vaccine. Kind of a medium reaction would be a dog that gets swelling of the face. I think most people have seen those pictures of dogs that get the puffy face from the vaccines. A very severe reaction would be more on the anaphylaxis or a whole body allergic reaction type thing, which usually involves vomiting, diarrhea, swelling. It can even go as far as including collapse for these kiddos. Now, anytime that you have a vaccine reaction in a dog or a cat, it is important to at least call the vet to see if you need to bring them in or if you can treat them at home. Some reactions, especially the more mild ones, can be treated with just something like a little Benadryl at home if you can only get a dose. But the more severe ones, kind of on the anaphylaxis or the vomiting and diarrhea side, do typically need to be treated in hospital. If your pet has one of those really severe reactions, you can definitely come up with a plan with your veterinarian to try to mitigate that in the future so that doesn't happen. If you're in more of the mild realm, your vet may talk to you about doing a Benadryl or a steroid injection before or the couple of days after a vaccine to try to reduce that. Now, one of the good things is, and I don't think a lot of people know this, there are several vaccine companies that if your pet has a new vaccine reaction to one of their vaccines, they will in some cases actually pay for you to treat that vaccine reaction. Now, if you know that they have a reaction and you like refuse to give Benadryl or something, they're not going to pay for that. But if it's a brand new reaction that you've never encountered before, it's definitely worth asking the clinic or contacting the manufacturer of the vaccine and filing it as a reaction case to see if they may pay for hospitalization or treatment or injections or whatever for that type of reaction.